the nostril or through the nose. Types of the tubes. There is a 3 types of the tubes. The one is short tubes, medium tubes, and the long tube. Short tube pass through the nose into the stomach, and medium tubes are passed through the nose to the duodenum and jejunum. Used for the most commonly used for the purpose of feeding. Long tube pass through the nose, through the esophagus and stomach into the intestine. Used for the decompression of the intestine. These are the tubes pictures. Okay. Now the size, nasogastric come into the various size. Start from the 8, 10, 12, 14, 16, and 18 French. Most commonly, we have to use 18 French from adult. Indication for GI intubation to decompress the stomach and remove gas and liquids. And lavage of the stomach, remove the ingested toxin. अगर किसी पेशेंट ने कोई टॉक्सिन इंजेस्ट कर लिया है तो उसे रिमूव करने के लिए वी हैव टू यूज NG tube intubation. And administration, medication, and the feeding purpose, and the management of an obstruction. As a part of the management of a hematemesis, if a patient come with the complaint of hematemesis, so we can pass the NG tube and aspirate the gastric content for the analysis. Intubation, okay. Assessment, how to assess who needs an NG tube intubation? Surgical patients. If a patient has a surgical history, we have to pass the NG tube. Ventilated patients, neuromuscular impairment, and who are unable to adequate oral intake to meet metabolic and the nutritional demand. ठीक है, most commonly किसके लिए हम लोग use कर रहे होते हैं? Who are unable to maintain the adequate oral intake. So we can pass the NG tube to assess the patency of the nares. Firstly, assess the nasal patency. सबसे पहले हम क्या देखेंगे कि फर्स्ट नेजल नॉस्ट्रिल को चेक करेंगे. हाउ टू चेक? फॉर द press your hand for the other nostril and press down and take ask to the patient for take a deep breath. ठीक है, उसके बाद हम क्या करेंगे? उसको assess करेंगे. Assess the patient medical history. If a patient has a nose bleeds, nasal surgery, deviated nasal septum, anticoagulation therapy, and GI history. And conduct a thorough physical examination. Assess the patient gag reflex, check करेंगे, and assess the patient of the mental status. Technique. What are the equipments we have to use? 14 or 16 French NG tube. ठीक है, and lubricant jelly for the apply on the tube, and pH test strips, tongue bladder, flashlight, emesis basin, syringes, 1 inch wide tape, adhesive tape, and suction available. Suctioning, and Euro bag, collection bag, and stethoscope for the confirmation of the NG tube placement. Now, explain the procedure to the patient and relatives. Position the client in a sitting or a Fowler's position. I will show in the picture. Examine the feeding tube or flows. Determine the length of the tube to be inserted. How to determine the length of the tube? ये सारी चीजें मैं आपको वीडियो में दिखाऊंगी. Measure the distance from the tip of the nose. Measure the distance from the tip of the nose and the earlobe. Pick up the NG tube from the tip of the nose and the earlobe and the xiphoid process of the sternum. इस तरीके से measure करना है. Prepare NG tube for the insertion. This is a Fowler's position used to promote drainage or ease breathing. Headrest is adjusted to desired height and bed is raised slightly under the patient knees, like this. Tip of the nose to the earlobe, and second picture shows that tip of the nose to earlobe and earlobe to the Ziphy sternum. Okay? Measure of the length of the nasogastric tube for placement into the stomach. If you are placed into the stomach, so measure like this. Tip of the nose to the earlobe and earlobe to the Ziphy sternum. Implementation: wash your hands, put on the gloves, lubricate the tubes with xylocaine jelly. Hand the patient of a glass of water and gently insert the tube through the nostril to back of the throat. Have the patient flex the head towards the chest. After the tube has passed through the nasopharynx, like this. Okay. Tube passed through the nostril in the rotated direction. Knee to the mouth, breathe and swallow during the procedure. After a patient take a deep breath and drink water. Swallowing the facilitate the passage tube through the oropharynx. When the tip of the tube reach cardia, stop the listen of the air exchange from the distal end of the tube. If the air is here, remove the tube. Advance tube each time client swallows until desired length has been reached. Do not force the tube. If resistance is made or client start to the cough, choke or become cyanotic, stop advancing the tube. If a patient is uncomfortable or a cough or a choke, so please stop the passing tube and pull back. If the NG tube intubation is completed, check placement of the tube. How to check? X-ray confirmation, testing pH, aspirate or stethoscope. At the end of the passing the tube, secure the tube with the tape like this. This is the position. Tube insert through the nostril and place into the stomach. When you have to insert it, how to confirm? You have placed right side through the stethoscope. Observe the patient determined to respond to procedure, and the persistent gagging, prolonged intubation and stimulation of the gag reflex can result in vomiting and aspiration. Coughing may indicate presence of tube in the airway. Noted the location of the external side of marking on the tube, and at the end of the documentation, size of the tube, which nostril and patient's response, record length of the tube from the nostril to end of the tube, and record aspirate, pH and characteristics. Now testing. Wash hand and put on the clean gloves. Draw up 30 cc. And how to test? How to test? You are going to be right side and the NG tube place into the stomach. How to check? Draw up the 30 cc syringe with fill of air and attach 30 cc syringe attached to the end of the NG tube. Now fill the air and attempting to aspirate the fluid. Drawback on the syringes: to obtain 5 to 10 cc to gastric aspirate, it means we are placed into the stomach. If unable to aspirate, advanced tube may be in air space. If intestinal placement suspected, withdraw tube 5 to 10 centimeter. Have the patient lie on left side, wait 10 to 15 minutes, and attempt aspiration again. Observe from the patient with enteral feeding, appearance of the enteral feeding, bile stain from the stomach, green, bloody, brown, and pleural fluid. And how to test: if after repeated attempts, if not possible to aspirate fluid from the tube was originally established, then you have to go for the X-ray examination. For the dislocation, remain in original position and client is not experienced is any difficulty. The nurse may assume the tube is correctly placed. Okay, now enteral nutrition. What is this? The administration of the nutrients directly into the GI tract. If a patient can't take orally, you have to pass NG tube and NG tube through the NG tube nutrition directly into the GI tract. The most desirable and appropriate method of providing nutrition is oral route, but this is not always possible. Nasogastric feeding is the most common route, and nurses are the main healthcare profession which is responsible for intubation. Administration and enteral feeds. Indications. What are the indications? Who are unable to maintain adequate oral intake, which I told you, to meet metabolic demand, surgical cases, if a patient has a surgery, if a patient is in the ICU, ventilated patient, and neuromuscular impairment. These clients have been referred to the dietitian. And the contraindication is that patient with diffuse peritonitis, severe pancreatitis, intestinal obstruction, and paralytic ileus. These are the contraindication. And blocked tube, most commonly क्या हो जाता है complications. What are the complications? Blocking the tubes. ठीक है. Dumping syndrome, solution with the high osmolality, water moves into the stomach and intestine from the surrounding organs and causes dehydration, hypotension, and tachycardia. And aspiration. These are the main complications. Number 1 is blocking the tube. Number 2 is dumping syndrome, and number 3 is aspiration. Ensure head of the bed elevated at least 30 degrees while feeds are being administered. Is it clear? Dehydration. Diarrhea is the most common problem. Electrolyte imbalance, maybe hyperkalemia and the hypernatremia. Oral mucosal breakdown and nasal irritation. This is the picture, and these are the suction tube attached with NG tube. Okay, this is the enteral feeding pump, feeding container. This is the feeding container, and this is the NG tube. Okay. Okay. Now I will share with you a video tutorial. Then we will discuss. Any question regarding this? Okay.
This is a video in clinical medicine from the New England Journal of Medicine.
Common indications for nasogastric intubation.
Just a minute. Okay.
Include decompression of the GI tract in patients with bowel obstruction and gastric emptying in intubated patients to prevent aspiration. NG tubes may be placed as an adjunct for the delivery of oral agents such as activated charcoal or oral radiographic contrast media. NG tubes are often placed in patients with suspected upper GI hemorrhage. However, the sensitivity and negative predictive value of nasogastric aspirates for detecting active bleeding is suboptimal, and the absence of bloody return cannot be relied upon to rule out hemorrhage. Nonetheless, nasogastric intubation may be useful in selected patients. Evacuation of blood and clots from the stomach may facilitate the endoscopic visualization of the gastric and duodenal mucosa, and the return of bright red blood does provide prognostic information. Nasogastric intubation and gastric emptying may be beneficial in patients with severe pancreatitis and associated ileus. However, it has been shown that NG tubes are not.
अब इसमें क्या शो कर रहे हैं amylase and lipase range क्या है raised है. If you can see the amylase and lipase range is raised, so it's mean a patient has a acute pancreatitis or other medical condition.
Not beneficial and in some cases detrimental in patients with mild or moderate symptoms. Nasogastric intubation should be avoided in patients with significant maxillofacial trauma, as the tube may enter the cranial vault if the thin cribiform plate has been disrupted. The procedure should also be avoided.
अब इन्होंने क्या बताया है कि facial trauma में NG tube is contraindicated. Why? Because it's a more complicated area. अगर वहाँ पे कोई फ्रैक्चर हुआ है और हम इंसर्ट कर रहे हैं तो पेशेंट क्या होगा और इरिटेट होगा और डिस्कम्फर्ट होगा. एंड इसोफेजाइटिस विद स्ट्रक्चर. अगर यहाँ पे स्ट्रक्चर भी मिल रहा है आपको और इन्फ्लेमेशन भी हो रही है, सो दिस इज द contraindication.
Avoided in patients with known esophageal abnormalities such as recent caustic ingestion, diverticulae, or strictures, as they are at high risk for esophageal perforation. Since nasogastric intubation may induce emesis, patients who are unable to adequately protect their airway should be intubated with a cuffed endotracheal tube if the procedure must be performed. Begin by gathering equipment you will need.
Equipments, which equipments do you have? Gloves, protective gowns, face shield, and NG tube, and vasoconstrictor spray, which I told you this is topical anesthesia, which is called xylocaine.
This will include gloves, a protective gown, and face shield, an appropriately sized nasogastric tube, vasoconstrictor spray, and a topical anesthetic such as benzocaine or lidocaine solution with an atomizer. Obtain a lubricant, a glass of water with a straw, towel.
And which purpose for the glass of water and a straw? If you are doing to insert NG tube and ask the patient take a sip of water and swallow slowly. So इससे क्या होगा कि वो आप NG tube जो पास कर रहे हैं वो easily insert हो जाएगी into the stomach.
Or blue pads, a 60 cc catheter tip 2-knee syringe, a stethoscope for tube
And what is the purpose of the syringe and stethoscope? For the confirmation which you insert the NG tube, that is the right side, right on the stomach.
Information, tape, and a wall suction setup. Have the patient breathe in through.
Now he is checking for the nasal patency कि कोई nasal blockage तो नहीं है, nostril is it nostril clear है. अगर कोई एक nostril भी block है तो हम उसको avoid करके other side of the nose nostril में हम लोग place करेंगे NG tube.
Each nostril to assess which side is more patent. Pre-medicate the nasal cavity with a
and apply the xylocaine jelly.
Vasoconstricting spray such as phenylephrine or oxymetazoline. Anesthetize the nasal cavity with a topical anesthetic such as 4% lidocaine or topical lidocaine jelly. The posterior oropharynx should also be anesthetized with lidocaine or topical benzocaine spray. Nebulized lidocaine may also be used. The proper depth of tube insertion is approximated by measuring the distance from the xiphoid process.
And how to measure the size of the NG tube, tip of the nose to the earlobe and earlobe to the G-free sternum.
To the angle of the mandible and then to the nostril. Lubricate the distal tip of the nasogastric tube with surgical jelly or lidocaine. Position the patient sitting upright in the sniffing position. Insert the tip of the nasogastric tube into the nasal cavity and slowly advance it posteriorly, parallel to the floor of the nasal canal. The tube should not be directed upwards. In this endoscopic view of the nasal cavity, note that if the tube is passed in an upwards fashion, it will reach a blind recess at the middle turbinate. When the tube is passed parallel to the nasal floor, it reaches the posterior nasopharynx without difficulty. Continue to pass the tube posteriorly. The patient may gag once the tube reaches the larynx. Temporarily halt the advancement of the tube and ask the patient to begin swallowing sips of water through a straw. Coordinating advancement of the tube with the swallowing mechanism facilitates passage of the NG.
इसको क्या कहते हैं, क्या कह रहे हैं पेशेंट को टेक अ सिप ऑफ वाटर, वो क्या कह रहे हैं डॉक्टर क्या कर रहे हैं, इंसर्ट द ट्यूब. ठीक है,
tube into the esophagus and prevents entry into the trachea. This is a fluoroscopic view of a nasogastric tube being inserted. As the tube reaches the level of the larynx, advancement is temporarily halted. The tube is then inserted as the patient swallows, and once past the larynx, is rapidly advanced. Note that in this endoscopic view of the larynx, the trachea is frequently open and may be accidentally intubated with an NG tube. Note also that as the patient swallows, the laryngeal apparatus rises and the epiglottis covers the glottis, preventing tracheal entry. Once past the larynx, the tube may be inserted. Check the black markings on the tube to confirm proper depth of insertion. Assure that the patient is in no respiratory distress and is able to speak. If the patient is unable to talk, is in respiratory distress, or if respirations can be heard through the tube, it should be removed immediately, as tracheal intubation has likely occurred. Attach the catheter tip syringe to the main port of the NG tube and insufflate 30 cc's of air while auscultating over the epigastrium. A gurgling noise should be clearly audible.
As the distal point of the क्या करा, एयर फिल थी उसमें, एयर को क्या करा, उसमें पुश करा तो एक साउंड अपीयर हुआ, लाइक अ बबल और गर्गल साउंड. जब ये साउंड कब अपीयर होता है, व्हेन यू आर एम्प्टी स्टमक. ठीक है, अगर आपको ये साउंड हियर हो जाए तो इट्स मीन के NG tube plays into the stomach.
Using the same syringe, aspirate the NG tube and ensure that it fills
gastric contents
with gastric contents. It should be noted that auscultation and aspiration may occasionally provide false positive results. Therefore, radiographic confirmation of tube placement by visualizing the NG tube's descent below the diaphragm should be obtained prior to infusion of any substance, such as activated charcoal or oral contrast media. The tube should be secured to the patient prior to transport to the radiology suite.
At the
Take
end
a
of the insertion of the tube, how to secure? Take a adhesive tape and cut into the Y shape.
5 to 7 centimeter strip of adhesive tape and tear it vertically for 1/2 of its length. The wide section is placed across the patient's nose, and the two tails are then wrapped in opposite directions around the NG tube. You may now connect the nasogastric tube to suction. Turn on the suction and adjust the vacuum force as desired. Minor complications of NG tube insertion include epistaxis, sinusitis, and sore throat. More serious sequelae include esophageal perforation,
pneumothorax, aspiration, or intracranial placement.
Aspiration, and rarely intracranial placement.
And just a minute here. This is the other video.
Hi, my name's Adam. I'm a medical
First, क्या
student.
करना है आपको? Firstly, you have to introduce yourself before starting the procedure
Can I take your name?
and confirm the patient details. If you are going to insertion the NG tube on this patient, if a patient is right,
It's Lewis Potter.
And what's your date of birth, Lewis?
It's the 5th of the 9th,
and
1988.
explain the
Okay.
procedure.
At the moment,
कि क्या आपका प्रोसीजर है. अगर कोई लैम्प पेशेंट आ रहा है तो आप उसको कैसे एक्सप्लेन करेंगे कि हम एक आपको खाने की नाली डाल रहे हैं थ्रू द नोज, और उससे क्या होगा, उससे आपको थोड़ी सी प्रॉब्लम होगी, थोड़ी सी इरिटेशन होगी. 5-10 मिनट का ये प्रोसीजर है. और इसके बाद जो आपकी कंप्लेन है, जो आप क्या कहते हैं ओरली नहीं ले पा रहे हैं कोई भी मील, तो वो हम किसके इस खाने की नाली के थ्रू डालेंगे.
you're unable to swallow food safely. Because of this, I'm going to insert a fine tube through your nose and into your stomach. It might be a little bit uncomfortable, but it shouldn't be too painful. If it does get too uncomfortable, let me know and we can stop. Are you okay for me to go ahead with the procedure?
Take a
Yes, that
consent.
sounds fine.
ठीक है. First introduce yourself, then explain the procedure, and then take a consent. And wash your hand and gather the equipments. Which equipments you have? Testing strips, syringes, lubricant, jelly and gauze, nasogastric tubes and dressing, gloves and aprons, and disposable bowl, and the glass of water with straw. Wear the gloves and don, and position the patient sitting upright. And measure the desired length of the NG tube to be inserted from tip of the nose to the earlobe, and earlobe to the Xiphi sternum. Noted the length and lubricate the tip of the NG tube.
I'm going to put the tube in now. It's going to be a bit uncomfortable. If you could take small sips of water while I'm advancing the tube and tap me on the arm if it gets too uncomfortable.
And gently insert through the nostril. Ask the patient to swallow a small sip of water. and ensure the tube is not coiling. Secure the NG tube. And how to secure? Like this, or adhesive tape. And this is a syringe to assess the gastric contents. Okay.
I've now finished the procedure. The tube will
At
get a
the
bit more
end of
comfortable over the next
the
few hours.
procedure, inform
To
the
complete
patient to the procedure is over and complete the procedure for
the procedure,
documented and the confirmation of the NG tube position. Inform the nurse to stop and not to use the NG tube until safe placement is confirmed.
I would order a chest x-ray to confirm the position of the tube if I was unable to aspirate gastric contents.
Any question regarding NG tube? Hello?
Why do students choose to study at BSBI? Perhaps it's because we offer
प्लीज ये चैट ऑन कर दें एडमिन एडमिन कोई एक स्टूडेंट मुझे अपनी ईमेल आईडी सेंड कर दे सो आई विल शेयर this presentation or a video. Any question? Any question regarding this presentation or a video? So you can ask me. Ahmad Ali, Tahir, there is any breathing difficulty while performing that procedure? ठीक अच्छा एक मोस्ट इम्पोर्टेंट बात क्या थी कि उसमें हम पेशेंट को क्या कह रहे थे कि टेक अ सिप ऑफ वाटर ठीक है दिस इज प्रिवेंटिंग फ्रॉम एनी ब्रीथिंग डिफिकल्टी ठीक है जब एनजी ट्यूब पास कर रहे होंगे तो हम पेशेंट को क्या कहेंगे कि टेक अ सिप ऑफ वाटर उसको हम पानी भी पिलाते जाएंगे साथ में तो उससे क्या होगा अवॉइडेड होगा क्या ब्रीथिंग डिफिकल्टी उसको नहीं होगी उससे एनी क्वेश्चन एनी अदर क्वेश्चन एनी अदर क्वेश्चन स्टूडेंट्स एनी अदर क्वेश्चन ओके ठीक है अहमद अली ओके थैंक यू मैम thank you so much almost this is the end of the class ठीक है